Okay, guys. Hello, good day. Magandang umaga. So, now this is our first discussion on our Hematology 2 laboratory. And so, simulan natin, class. So, what are we going to expect today? So, we will have an overview on hemostasis so that we will speak the same language, we will speak the same terms. Kailangan natin ng a little bit of overview. We're going to differentiate your primary and secondary hemostasis. We'll talk about your capillary fragility test and bleeding time, and we will have platelet count and direct estimation. Okay, so class, hemostasis, so as much as possible, we don't want that blood will be pouring out of our blood vessels. And so hemo means blood and stasis means the prevention of flowing. Yan. Or anong flowing ang pinaprevent natin? Bleeding specifically. So hemostasis class is the cessation or the stoppage of bleeding. So that is one of the goal of the blood or the coagulation system class so that you will not bleed out. Yan, not bleed out. We need to have a process of hemostasis. And class, hemostasis is just incredible. There's so many factors, there's so many actors involved para mag-succeed sa hemostasis. And if one of those factors are missing, then that person could be prone to bleeding tendencies. Ganyan. So, isang factor lang ang nawawala, isang elemento lang nawawala, class. It would destabilize the whole system. Yan. So, class, I hope that you are excited to learn more about hemostasis. Because what else? Ano pa ba? Andito sa PowerPoint natin, retains the blood within the vascular system. So class, blood should only be inside your blood vessels. Yan. It should be inside your arteries, your veins, your capillaries. Yan. So if the blood is outside or seeps out of this vascular system, so pwedeng magkaroon ng bruising, 'di ba? Sa simula, ganyan. Or that bleeding. Next, localize the reaction in the site of injury. So, as much as possible, hindi na lumalala, hindi na lumalaki yung mga wound or the site of injury. And third one, re-establish the blood flow in the blood vessels. Yan. So, we want that the blood will continue flowing. Yan. The blood flow is re-established. Yan. So, in this image, class, so apparently, a few of the red blood cells are going out of the blood vessels due to a broken or an injured vessel wall. Yan. So hemostasis is initiated, it happens once there is injury in the blood vessel. So class, kung injury pa lang in the skin, it did not affect any capillaries, yan, wala bang hemostasis na mangyayari. Actually, walang bleeding nangyayari sometimes, di ba? And class, ayun, so there are so many factors involved, not only your platelet. Yan, so yun ang mamumulit sa atin nito. Blood vessel actually is also an actor in hemostasis. And the goal, class, is to make a stable fibrin clot. So after primary hemostasis and secondary hemostasis, the goal is there should be a stable fibrin clot. This fibrin clot will serve as a stable clog or a plug so as to prevent bleeding, yan, or to stop the blood from seeping out of your blood vessel. So ang goal natin is to make a stable fibrin clot. Is to make our goal natin. Actually, wala tayong ambag doon. So, as long as you stay healthy, yun ang pinaka-ambag mo. So, the platelets, the different factors are working their are working their magic. Yan. So, yun pag-uusapan natin ngayong semester na to. So class, we have two main parts of hemostasis. We have primary and secondary hemostasis. Actually, when the injury is not as severe, and it's like a paper cut, yan, simple lang yung injury, actually, hanggang primary hemostasis lang tayo. So, ang goal lang is to make a platelet plug. But class, if the injury is larger than expected, so there are two parts. Primary up to the secondary hemostasis until the creation of a stable fibrin clot. Right. So class, the main actors in your primary hemostasis are your blood vessels and your platelet. Yan. Sa ngayon, mukha lang konti. But class, your blood vessels and platelets actually also secretes so many substances yan, that helps in the process of hemostasis. But the main actors are blood vessels and platelets yan, sa primary hemostasis. So class, kung there's something wrong with the blood vessels, if it's weak, yan, or it's or in the process of aging, or there's allergy, yan, it could, so it would affect the primary hemostasis. So if there's something wrong with the quantity of platelet, masyadong marami, masyadong konti, or its function, yan, yung tignan natin yung function ng platelet mamaya. So that's a problem of primary hemostasis. Yan. So class, your primary hemostasis starts it's initiated by a damage in the endothelium. So class, endothelium are your squamous cells that are found in your blood vessels, your endothelial cells. Yan. So kung na-disrupt itong mga endothelial cells, yan. So due to injury or blood vessel injury, mag-start na po ang primary hemostasis. Yan. So what are the major things that happens during our primary hemostasis? Of course, there's blood vessel injury. So once there is blood vessel injury, now your platelet will be activated. Yan. So your platelet could be activated due to the change in turgor pressure in the blood flow, and the secretion of prostacyclin. So basically, yung prostacyclin class, it's a, sabihin natin, bat signal or a chemical signal which activates your platelets. Yan. Next is platelet adhesion. So, adhesion, didikit. Yan. Saan didikit, ma'am, ang platelet? So, it sticks in your, so your platelet will adhere on the walls of your blood vessel in the site of injury. Yan. And the glue that facilitates the sticking or the adhesion of your platelet in your blood vessel is this VWF, this von Willebrand factor. Yan, von Willebrand factor. Yan. So this serves as a glue so that your platelet could adhere in the walls of your blood vessel. Galing, no? And class, the part of the platelet which adheres to the von Willebrand factor is GP1B9. GP means glycoprotein. So the glycoprotein that adheres, the part of the platelet that adheres to the blood vessel or von Willebrand factor is GP1B9. So class, magka-partner ang von Willebrand factor and GP1B9. Okay? And after, once your platelets, so maraming platelet na ang nag-adhere sa site of injury, now platelet release reaction. So your platelet will release different substances that will promote coagulation. Yan. So, or the signaling of other platelets to come to the site of injury. And platelet aggregation. So class, so once the other platelets are already signal or in the site of injury, they will aggregate. Yan, magkukumpul-kumpul sila, forming a platelet plug. Yan. For this to happen, para mag-aggregate sila, the part that is aggregating, yan, on the plate, kung saan sila nagdidikit-dikit class, ng part ng platelet, it's in the GP2B3A. Yan. So, glycoprotein 2B3A. So, facilitate. So, these are the site where your platelets aggregate with each other. Yan. Sa GP2B3A. And class, so that they could be intact. Yan. Para makagawa ng plug, so there is the need of fibrinogen. Yan. So class, and the end product is a platelet plug. So usually this is temporary. So this is good when the injury is not that severe. And however, class, when it's so severe, so there's a big injury. And so secondary hemostasis is activated, and the main actors for secondary hemostasis are your platelets and coagulation factors. So factor 1 to 13, so they are represented by Roman numerals. So we don't have a factor 6 except 6, 1 to 13 except 6, and fibrinolytic factor. I'll talk about fibrinolytic factor in a while. So class, So secondary hemostasis happens when there is the release already of tissue factor. So tissue factor is produced by your collagen. So pag mas malalim na yung injury sa blood vessel. So class, what happens in your secondary hemostasis is coagulation system becomes activated. Yan. So coagulation is activated. So there is the formation of thrombin. Yan. Tapos class, and eventually fibrinogen is converted to fibrin. Yan. So once fibrin is created, class, it's more stable. So yung fibrinogen na convert sa fibrin, so it's more stable. Yan. And keeping the blood vessel plugged. Yan. So class, ma'am, bakit ganon? May fibrinolytic factors. Yan. So class, so this the clot yan is not permanent. Yan. Eventually, we need to lyse it or break it down. Why? Because class, some of this clot yan excessive formation of clot can cause stroke. Yan. Or it can cause blockage in the blood vessel. Kaya eventually, dapat malyse rin to through fibrinolytic factors. Yan. So eventually, there is wound healing in the endothelial cell. Nag-heal na. So na-plug, di ba? Or nagkaroon ng clot. Eventually, we need to lyse that clot because there is already healing in the walls of the blood vessels. So, ayun, kailangan natin ng fibrinolytic system. So, class, pag walang fibrinolytic system, the person is prone to clotting. Ayan. So, pwede siya ma-stroke, ma-aneurysm. Okay. So, class, how do bleeding disorders happen? Ayan. So, bleeding disorders happen when there are vascular defects, platelet defects. So, there's something wrong with your primary hemostasis. There are coagulation factor defects. So, pag sinabing coagulation, sure, secondary hemostasis na yan. And presence of circulating anticoagulants. Yan. So, as we go on, we're talking about circulating anticoagulants. Yan. Example, lupus anticoagulants. Vascular defects. Yan. So, simulan muna tayo sa vascular defects. So, pag vascular defects, primary or secondary hemostasis? Primary. Okay, so there's something wrong with the blood vessels. Yan. So either they have increased permeability or increased fragility. Yan. So when we say permeable, class, the different elements or materials could easily pass through the blood vessel. Yan. Vascular bleeding disorders result from defects in blood vessels. It is exhibited through petechiae, purpura, and bruising. Yan. So, kung may class, kung ikaw prone ka sa pasa, yan, purpura, or petechiae class, pwedeng there's something wrong with your blood vessels. So, class, vascular anomalies happens either they are acquired or hereditary. Yan. So, class, paki-go over na lang to. So, scurvy class, example is acquired siya. So, it's vitamin C deficiency. We have senile purpura. Pag sinabi natin senile class, the person is already old. Yan, geriatric patient. So, class yun, mga mga elderly people natin, they already have weak capillaries. Yan. So, pag inano mo sila ng capillary fragility test, mas high probability na magpa-positive sila sa capillary fragility test. And yun, class senile purpura are old, senile. Anong opposite ng senile? Juvenile. Yan, mga bata naman, juvenile. Okay, yan. So, what else? Hereditary. So, hereditary telangiectasia, Ehlers-Danlos, deficiency in vascular and perivascular collagen. So, yeah. So, let's go over it. So mag-focus tayo sa mga laboratory tests. So laboratory findings in vascular defects. So take note class, ang vascular defects is there's something wrong with your primary hemostasis. Yan. So syempre, ang mag-a-abnormal pag may vascular defects are mga test para sa primary hemostasis. And usually these tests are your bleeding time and tourniquet time. So expect that if there's something wrong with your vascular system, example, you have scurvy, yan, or you're already old, yan. So expect a prolonged bleeding time and positive tourniquet test. Yan. So may grade 1, 1+, 2+, 3+, ganyan. But class, you are normal in your coagulation time, clot retraction time, prothrombin consumption time, partial thromboplastin time, platelet count. Because class, these are tests under your secondary hemostasis. Ma'am, yung platelet count, ganyan. So class, since these are vascular defects naman, so hindi affected ang platelet. Yan. So, test for primary hemostasis. So, first off is your capillary fragility test. So, we are assessing the stability, the strength of your capillary specifically. Yan. If they are subjected in increased hypoxia and pressure. Yan. So, class, kung tinanggalan mo lang oxygen, kung tinaasa mo yung pressure, ano kaya ang estado ng capillaries mo. Yan. So, class, if you are positive for capillary fragility, so perhaps you have vascular purpura, thrombocytopenia, hypofibrinogenemia. So note class, or vascular defect. So note class, this is a very non-specific test. Yan. So class, you have to check. So these are PETK after a capillary fragility test. So before testing class, you have to check whether there are already may mga pantal-pantal na yung pasyente, ganyan. Or kaya may skin disease yung pasyente or burnt patient. Class, of course, you cannot do CFT because you could not clearly assess the PTK formation. Paano ma'am kung may chicken skin yung pasyente, 'di ba? Or ikaw may chicken skin ka. Yan, syempre you could mistake it as PTK. So you have to choose the best site wherein there's no really marks. Yan. Especially if the patient is hairy, hindi mo rin makikita. So marami ring contraindication ang capillary fragility test. Maraming limitation plus ang CFT. Yan. So class, there are two main tests under your capillary fragility. We have your tourniquet test and your Hess or suction test or petechiometer method. Yan. So ito yung mga general na test. Kasi tourniquet test class, these are the ones, itong Rumpel lead, Quicks, and Goslings. Class, you provide positive pressure. You apply, positive pressure on the finger or in the arm. Yan. Sa Hess suction test class, you apply negative pressure. So there's a suction. Yan. Suction naman itong Hess or suction test. Okay? So class sa tourniquet test, we have 3. So Rumpel lead, Quicks, and Goslings. Sa Hess or suction test, yun. So application of negative pressure of sufficient degree to the skin and indirectly to the vascular tissue causes the extravasation of blood, the extent of which will provide measure of permeability. Yan. So, if there is 0 to 2 PTK at 200 millimeter mercury, suction to so within the normal range ka pa. Pero pag 4 to 8, you have to repeat it. More than 8, it means that the capillary is already fragile. So, Rumpel lead. So, this is our activity 1. Yan. So, ito. So, class, dito na lang tayo. So, class, I made a specific grading to assist you guys. So, 0 to 10, 1 plus. Yan. 10 to 20, 2 plus. 20 to 50, PTK, 3 plus. And 50 and above, 4 plus. Yan. So, pag 2 plus ka na, indicative of capillary weakness. Yan. So please review the steps in our manual. Isn't it that the pressure that we use is 100 millimeter mercury if you're using a cuff. Yan. So class, number 2 is the Quicks method. So apply pressure to the upper forearm, inflate the pressure midway, systolic and diastolic for 5 minutes. And release and inspect for petechiae. So still you are applying pressure. Yeah. So the reference is 0 to 5 petechiae in a 5 centimeter circular area. Yan. So beyond that is the capillaries are weak. And third of the tourniquet test is your Gothlin. Yan. So ito naman, both arms and inflated at 35 millimeter mercury. Multiply the number of petechiae in both arms by 2. Yan. So more than 12 is fragile na. Yan. So class, just an image to show you. So ang pinakamaliit na natin na mga dots, pinpoint dots are your petechiae. So they are usually less than 3 millimeters. So a little bigger are your purpura, more than 3 millimeter. Your ecchymosis or your bruises are 1 to 2 centimeters. Hematoma, collection of blood outside the blood vessels. So class, these are symptoms. These are signs. These are signs of bleeding a little bit. Yan, pwede. Yan. Or indicative of bleeding. Yan. So you just have to watch out for these ones. Next, guys, is bleeding time. Alam ko, experiment for photo. Pero class, magkasama kasi. Yan. So it is the time it takes for a standard wound to stop bleeding. Yan. So we inflict a wound to our patient as just a small wound and incision using our lancet. Tapos class, we will time how long would it bleed or how short of the time that it would stop bleeding. Yan. So number 1, so it will depend on the platelet plug formation. So it depends on primary hemostasis. It depends on the integrity of blood vessels, and actually it can also depend on the coagulation factors. But bleeding time is for primary hemostasis class. Yan. So first is your Duke's method. Yan, mamaya tayo sa IV method. So when we say Duke method, dapat your brain, it goes to the earlobe. The site of incision is the earlobe. Yan. So pag Duke's method, hindi sa forearm but sa earlobe. Yan. So puncture to a depth of 3 millimeter with a sterile disposable lancet. Immediately start the timer as soon as the last drop of blood appears. First drop of blood appears. Yan. Drop of blood with filter paper every 30 seconds, making sure that the filter paper does not touch the wound. Yan. So please do not touch the wound when you are doing bleeding time so that you will not disrupt the formation of platelet plug. Yan. Stop the timer as soon as the last drop of blood disappears, as soon as the bleeding stops. Yan. So dapat, as much as possible, the incision or the bleeding will only last within 4 minutes. Yan. So beyond that, class, yan, it could be a indication of there's something wrong with vasoconstriction, platelet plug formation. Pwede. Yan. So class, itong bleeding time, actually nire-request pa to ng mga dentists every time someone will, when I was working in the hospital, na nire-request ng mga dentist bago magpagbunot ang mga pasyente, class. Ayan. But actually, this also crude already and very non-specific. We have IV's method. Yan. So IV's method is the one in your experiment number 4. Yan. So for capillary fragility test, the blood pressure cuff is set at 100 millimeter mercury. So class, sa IV method, 40 lang, ha? So yan, apply the pressure cuff on the patient's upper arm, forearm. Inflate it up to 40 millimeter mercury. Yan. So maintain the pressure all throughout the entire procedure. And so nilagay mo dyan, and get the the volar forearm. Yan, volar surface of the forearm. Yan. Disinfect an area approximately 3 fingers width below the bend of the, dito, yan, dito, on the volar surface of the arm with 30% alcohol. So clean it out. Yan. Hold the skin tightly by grasping the underside of the arm firmly. Make 2 skin incisions. Yan. 2 millimeter deep and 2 millimeter long. So what we use usually is the butterfly lancet, avoiding any subcutaneous veins. Yan. Kaya ditong banda, volar surface of the arm. Start the timer once the first drop of blood appears. Yan. Blot the drop of blood with filter paper every 30 seconds. Yan. So you're going to assess. Yan. Making sure that the filter paper does not touch the wound so that you will not disrupt the platelet plug formation. Yan. Tapos, stop the timer as soon as the last drop of blood disappears. Release the pressure cuff and record the bleeding times of the 2 puncture sites and report the average result. 2 to 7 naman to. So class, when I was an intern or when I was performing this, class, ninanumberan ko yung filter paper. Yan. So, yan, 2 minutes. Yan, 2 minutes 30, every 30 seconds. So, nilagyan ko 2 minutes, 2:30, 3, 3:30. So, pagka 2-minute mark, may dugo pa, blot. After 2 minute 30 second, blot. Yan, 3 minutes, blot. So, you keep blotting every 30 seconds. After, hanggang mawala na, hanggang maubos. So, sabi niya, record the bleeding times of the puncture site and report the average. Yan. So, since you punctured 2 sites, so report the average. Anong oras sila huminto mag-bleed? So, again, ang IV's method class. The reference time is 2 to 7 minutes. Yan. So, class, clinical significance of bleeding time. So, either there is decreased platelets in cases of thrombocytopenic purpura, acute leukemia, aplastic anemia, platelet deficiency, yan, and injury in the capillary wall. So other test class, these are historical tests of your bleeding time. So we have Copley-Lalich immersion test. So a punctured finger is immersed in a beaker of a pre-warmed NSS. Yan. Observe and time the following out of red blood against the colorless NSS. So hanggang mawala. Stop the timer as the blood stops flowing out. Okay, and we have aspirin tolerance test or quick test. I don't think ginagawa na to kasi you are giving a patient aspirin eh. So overdosage of aspirin prolongs bleeding time. So if you give the patient 4 tablets of aspirin ng marami, plus aspirin yun nga, increases the risk of bleeding. Kaya I don't know, hindi na to ginagawa, class. Yan, please search quick test. So, bibigyan mo daw ng 4 are enough to prolong bleeding time of a normal individual. So, sa normal individual lang dapat to ginagawa. Okay? And just 2 tablets are enough to prolong the bleeding time of a patient with von Willebrand's disease. So, if you have von Willebrand factor deficiency, yan, 2 tablets lang daw, magbe-bleed, magproprolong na yung bleeding time mo. And thrombopathia. The patient will abstain from aspirin for 3 days. Yan. Tapos you will do Dux method before and after the intake of 2 aspirin tablets. So how much aspirin could you tolerate? Yan. So pag binigyan mo ng patient ng 2 aspirin tablets, normal patient class, dapat normal pa rin yung Dux method niya. Pero pag ang binigyan mo ng 2 tablets daw, ang pasyente na may von Willebrand's disease saka thrombopathia, yan, 2 aspirin lang, magproprolong na. Okay. So, yan class. So, let's head to our platelet count. Yan. So, your platelets, class. Huwag kakalimutan ng size 2 to 4 micrometer. But I'm seeing 1 to 4 micrometer. And its volume is 5 to 7 femtoliters. Yan. So, class, your platelet are so important. Yan. It's for hemostasis, maintaining the vascular integrity. So, it assists your blood vessels and it is important in the process of blood coagulation. So, hindi mag-work ang coagulation system kung walang ambag ang platelet. Okay? So, class, the laboratory activity is focused on the visual method. Yan. So we are using the two methods that are shown in the laboratory are phase contrast microscope and light microscopy. Class, wala tayong phase contrast sa University of Baguio. However, we just subdue the light using binababa lang natin yung ilaw. Ang sad. Yan, ng light microscopy. Magkaiba yung mga diluent na ginagamit natin sa visual method. Yan. However, the reference method are actually your automated machines. Yan. The voltage pulse and the electro-optical counting systems are reliable in quantitating our platelets. Yan. So class, yung activity 3 and 4 natin, yung 3 natin, activity 2, is about the direct count or the visual method. So the specimen of choice is our venous blood in EDTA. So EDTA yung anticoagulant natin ha. So no color ng EDTA. Yan. So class, pag sa tongkantins or light microscopy, yan. Kita mo yan, no? Tongkantins. Yan. So, the diluting fluid is Rees and Ecker fluid. So, pag narinig nyo ng Rees and Eckers, that's your tongkantin method. In your 1% oxalate, ammonium oxalate class, that's your Brecker-Cronkite method. Or, so, the equipment that we use is phase contrast microscope. Yan. Ano pagkakaiba ng mga diluent? So, Rees and Ecker is an isotonic fluid. Yan. Anong noon, class? Isotonic. Anong impact noon sa red blood cells? Yan. Pag isotonic ang solution. Anong impact ng hypotonic solution? Kasi 1% ammonium oxalate, hypotonic siya. So, anong impact noon sa red blood cells? Guys, sa inyo na yun Isipin nyo. Yan. So, ayun, isotonic ang Rees, hypotonic ang 1% ammonium oxalate. So, what are the effects in your red blood cells? Sa inyo na yun. I-research yan. Okay. So, tongkantins method, class, other than the diluting fluid, we use RBC Thoma pipette. Yan. So, di ba hanggang 101 mark? Yan. And class here, in diluting fluid, so dilution vial and phase contrast microscope. And so class, so for the composition of Rees and Ecker, so class, we have 1, 2, 3, 4. So trisodium citrate, anong purpose kaya ng trisodium citrate? Brilliant Crescil Blue, 40% formalin and distilled water. Yan. So class, ano kaya ang gamit? Yan. Please search. I think hindi yan nasa question for research. Yan. And class, it should always be, the Rees and Ecker should be always filtered and centrifuged before use. The stock bottle should be tightly sealed and refrigerated. Class, yung 1% ammonium oxalate class, it should always be freshly prepared. Yan. So class, it's very important that you know where we count your platelets. Yan. So pag sa tongkantins or light microscopy, we count it in the 4 large WBC square. Isn't it that this is your hemocytometer? Yan, your Neubauer hemocytometer. So, 4. Ganda ng araw. Yan. So, 4 large WBC squares. Diyan tayo nagbibilang. Ma'am, bakit sinasabi niyo sa amin to? Because this is important in the computation of our volume correction factor. Yan. So, class, ang VCF natin is equal to 1 divided by the volume of the square times the number of the square. So, paano i-compute ang BCF pag nagbilang tayo sa 4 large WBC square? So, 1 divided by anong volume nito. So, ang volume nako-compute ng length times width times height. Yan. So, yung length at width natin is 1 millimeter. Yan. So, 1 times 1, yung depth natin is 0.1 times 4 kasi 4 large WBC squares. Anyway, I'll show you the computation later. So, same thing with your phase contrast. Nagbibilang tayo sa 10 small WBC square. Yan. So, para makuha rin yung BCF, 1 divided by volume of the square times the number of the squares you counted. So, ano ba ang volume ng isang red blood cell, red RBC square? So, 1, ano to? Kasi 1 millimeter to. So, 1 divided by 5. Yan, 0.2. So, 0.2 times 0.2 times 0.1. Yan, parentheses times 10. So, 1 yun. Anyway, I'll show you. Okay. So, paano ba ang formula? Yan. So, paano mag-compute? So, cubic millimeter class is also similar with your microliter. So, platelet microliter or platelet cubic millimeter. Pareho lang. Pero pag per liter na, kailangan na mag-convert, okay? So, total number of platelets you count times BCF times DF. Yan. So, BCF, how do you compute it? So, 1 divided by the volume of the square used times the number of squares used. Yan. So, paano computein ang BCF ng WBC square? So, 1 divided by, hindi ko nalagay eh. Yan, 1 times 1 times 0.1, yan, times 4. Yan. So, 2.5 ang sagot. So, mag-iiba ang BCF class. Pag sinabi ko, nagbilang ang medtech sa tatlong WBC large squares lang, diba? So, I think that's your QFR. Gagawa na lang ako ng computation nyo. So, mag-iiba rin ng BCF constant kung sa phase contrast microscopy ang ginamit nyo. So, 10 RBC square. So, 1 divided by 0.2 times 0.2 times 0.1. Ma'am, saan nakuha yung 0.1? So, this is the depth of the hemocytometer. 0.2 class is the length and the width of your RBC square. Yan. Sana class, hindi lang ngayon yun lang narinig to. Okay? Times 10, kasi 10 RBC squares. Pag sinabi ko lang 5 RBC squares, syempre mag-iiba yung BCF nyo. So, 25. Ayan. At mga kapatid, paano i-compute ang dilution factor? So, volume of the fluid in the bulb over volume of sample use. So, kung gumamit ng RBC Thoma pipette, volume of fluid in the bulb is 100. So, pag gumamit ng WBC Thoma pipette, the volume of fluid in the bulb is 10. Yan. And the volume of sample used. Yan. So, kunyari, ang blood na ginamit nila, 1. Yan. So, 100 divided by 1, the DF is 100. Yan. So, if the volume of the fluid in the bulb is 100, pero yung volume of sample use is 0.5. Yan. So, DF is 200. Ayan. Yan. So, class, how do we count in your Neubauer? So, inverted L. Yan, inverted L rule tayo. So, binibilang natin lahat ng mga nagtatouch dito. Hindi natin binibilang yung nagtatouch dito, yung mga red. Yan. So, lahat ng nagtouch na platelet within our inverted L, yan, kasama sa bilang natin pag nagtouch. Pero pag dito na siya nag-touch, yan, hindi na binibilang. So, pag dito na siya nag-touch class, sa ibang grid na siya counted. Pero since WBC naman pala to, hindi pala counted. Sorry. Okay. So, example class. So, a medical technologist counted 300 platelets using the Tonkan-Pins method. The MT used 0.5 blood sample and counted on the 4 large WBC squares. Compute for the platelet per microliter or platelet per cubic millimeter. So our reference range is 200 to 400,000 per microliter. Yan. So una, BCF muna. So class, since apat na WBC square, so 2.5. Yan. So, class, nag-iiba to. Depende sa, since sinabi ko namang 4 large WBC square, 4. Yan. Tapos, class, so volume of fluid in the bulb, 100, kasi toma pipette ang ginamit. Hindi ko sinabi. Pero tong canteen method naman kasi. Volume of sample use, 0.5, so 200. So, yan. 300 times 2.5 times 200 is equal to 150,000 per microliter, which is less than the reference range. Yan. So, class, ganyan lang kadali. Please practice. Class, so this is a computation when there is, when you count only in one chamber. Yan, sa one chamber. So, class, pag sa dalawang chamber ka nag-count, yan, you get the average number of platelets on chamber 1 and chamber 2. So, kunyari, 300 yung nakuha mo sa chamber 1, tapos 250 yung nakuha mo sa chamber 2, 275 yung average. Yan, 275. So, 275 times 2.5 times 200. So, ganun na. So, kunyari, medical technologists counted 300 platelets in chamber 1 and 250 platelets in chamber 2. Yan. Get the average of the two chambers, then compute kung same naman yung ginamit niya. Diba? Na BCF and DF. And class, platelet estimation. So, class, actually, this is my guide when I was working in the hospital. So sometimes your machine flags, yan, so that you could just estimate and check if the correctness of the count. So you could do platelet estimation. So once you will make a blood smear, gumawa ka ng smear and you stained it and dried it down, yan. So under oil immersion is you could count the platelet. Yan, you could count the platelet. So class, sa visual method, lang tayo, hanggang high power lang tayo, ha? High power objective. Dito sa platelet estimation, we use oil immersion. So pwedeng mag-oil dito, hindi pwedeng mag-oil sa hemocytometer, guys, ha? So the average number of platelets in 10 consecutive fields times 20,000. So class, you will look at 10 fields. Yan. You will count 10 fields. Kunyari, sa unang field, yan, 5. Sa next field, 10. Sa third field, 4. And you're going to get the average platelets in the 10 consecutive fields and multiply it by 20,000. And class, yun, you will report qualitatively. So, kunyari, 100 to 149, slightly decrease, 150,000 to 190, low normal. Class, minimemorize namin to kasi lumalabas to sa board exam. So, ma'am, what does your platelet look like under oil immersion objective? So, usually it's stained depending on the pH of the stain. Dapat, ang tama, class, dapat siya, may pagka-violet or lilac in color. Yan. So, it's small. Yan. It's way smaller than your red blood cell. Ang red blood cell natin is 6 to 8 microliter. Ang platelet natin, 1 to 4 microliter. And class, if you're going to zoom in, actually, may mga extensions or protrusions in your platelet. Those are actually pseudopods or false feet. Yan. Parang may mga extensions ng mga buhok eh. Pseudopods or false feet. Yan. So class, ito example sa inyo na, kayo na mag-compute. Yan. So your medtech, yan, scanned 10 fields under the microscope, under OIO. So sa field na 1, sa unang circle class, sa unang field, 9 yung platelets, yan. Sa second field, 15, 6, and so on, yan. So class, so simply get the average from field 1 to field 10. So kunin mo yung average nito and multiply it by 20,000. Then, interpret. Okay, so class, kayo na ang sumagot niyan, ha? Kaya niyo yan. So, yan class, thanks for listening, and that's it for our discussion. Bye-bye, guys.